Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about yoga for overall better health. Today's guests are Diane Russ, who is a certified yoga instructor, and Karen Williams, who is a practicing yoga student. All right, thank you so much for being here today. I appreciate it.
Thanks, Jeanne.
Nice to be here.
Now, we'll start with the easy. How long have you been teaching yoga, and how about practicing yoga?
Yeah, Jeanne, I've been actually into Hatha yoga for 43 years.
Wow.
I started in the late 60s, and since that time I've also become a certified Hatha yoga teacher and a 500-hour certified yoga instructor, which is really, quite the thing.
Oh, yeah.
But for 43 years, teaching, practicing, and then, of course, studying yoga.
So in the 60s, was it that sort of when it was just showing up in the United States, or?
Yeah, actually, in the 60s, it kind of came to this country with the Beatles.
Oh, yeah.
But it also came to this country beforehand in the 1950s and even in the 1940s. The woman's name was Indira Devi. And she brought it to this country, and it was basically for the movie stars so that they could tone physically and mentally and become, more aware of their own bodies.
Oh, yeah.
More so for better health for them as well.
Oh, yeah.
And it's evolved over the years into a wonderful practice of health care.
All right. How about you, Karen? How long have you been?
About 6 years,
Okay.
on and off. I've had some health issues in between, but I've been with Diane for 3 years.
Oh, yeah.
Yeah.
She's a very popular instructor.
Yes, she is.
Thank you.
So let's go back to yoga in general, and for viewers that may not be real familiar, what is it exactly? What is
Okay.
yoga?
I'm going to give you the very simplistic form and definition of yoga. Yoga is a Sanskrit word, and it's you. That's the word in yoga. And what it means is yoke or coming together.
Okay.
And hatha, ha means sun and tha means moon. So it's hatha yoga, means taking in the whole aspect, the sun and the moon, the whole of the body, the whole physical and the mental and the spiritual aspect of the body.
Okay. Is Hatha yoga the most familiar to people, do you think?
I think it's the most that they recognize with, and it's also one of the yogas that so many others come from. There are so many limbs of yoga, and Hatha yoga now has become the most popular because it is for health. It is for mental awareness, it is for spiritual health, and for physical health.
So is Hatha sort of the base of all other yogas, because there's a lot of other terms or other yogas that you hear about?
Yeah, I
there.
couldn't say that Hatha is the base. I think with all of the other limbs of yoga, it is a limb of yoga.
Okay.
It is one of the most popular ones because of what it does for the body.
Okay, good. Now, as far as who can take a yoga class, is it anybody?
Anybody.
Anybody.
Absolutely anybody.
Absolutely anybody.
Men
Okay.
and women and children, and I don't care how old you are. You can
Really?
be very, very young. They have yoga for children. And then, of course, they have yoga for seniors and yoga for the elderly. And when you get into senior and yoga for the elderly, it's chair yoga, yoga for people that cannot get on the floor, yoga for people in bed, in wheelchairs.
Oh, yeah.
So yoga can be for everybody.
Okay. Have you had a diverse age group in the classes that you teach?
Oh, definitely. I teach for DY, Dennis Yarmouth Adult Ed.
Okay.
I also started many years ago in the school adult ed system, so I've become very familiar with bringing together a program of yoga for beginning students, intermediate, and maybe students that have had yoga practice before.
And the size of your class is?
My sizes can go anywhere from 6 people to 20 or 25 people.
Do you find that most of your participants have done it before?
I think most have done it or had some experience, but I have very new people, and I love the new people.
Oh, yeah.
I call them newbies. And it gives me a chance to really teach the aspects of yoga.
Yep. Now, Karen, 6 years you've been practicing. Can you tell us a little bit how you got involved in yoga in the first place?
I got involved. A friend suggested it after my husband died, and hers had passed the year before. And through the fog period, it was very difficult. And I ran into her, and we talked, and she said, one of the things that's helped me get through is I started yoga with my daughter. And she said, you should come. And it was right up the street, so I went, and I never stopped. It was wonderfully beneficial to getting me to a place that was peaceful, finally, and was great for my body in the meantime.
In the meantime, yeah, yeah.
So it really it does bring you a lot of peace and a lot of flexibility. Just, it's great.
Were you surprised with that when you first started going?
I was very surprised,
yeah.
Very surprised. When you do the meditation, you know, you can let your mind just go, and it gets rid of all the negativity that you have in there. And then when you finish your class, the energy you have is amazing.
Oh, yeah.
Yeah.
So it's not energy draining?
Not at all. Not at all. It fills you with energy. I go home and I'm, you know, doing things at 9 o'clock that I don't usually do.
Hadn't planned on getting done.
And it's like, I'm usually in bed by 9 o'clock.
Oh, yeah. How often do you practice?
Right now I'm practicing once a week, but
okay.
I'm hopeful that in the spring I'll be able to go to a 2-week course,
yeah.
two days.
Oh, twice a week?
Yeah.
Yeah. Do you do it at home?
Sometimes. Not as often as I'd like to.
Yeah.
I have a stressful job, and you know, so it's
so it would
hard
even
for
be
me to
more
do.
beneficial,
Yeah.
right?
Yes.
Yeah.
Yep.
So why is that, do you think, Diane? That, because I'm also in the classes, so I have that same feeling of, boy, this would be great. It's good to go to a class that's dedicated for that purpose and make yourself go, and you do feel fabulous after, but what is it about going home and being able to get it done?
It's difficult. It's like anything. You're in the class, you have an instructor, and the instructor is giving you direction as what you should be doing, and you're opening your ears, you're opening your soul to this particular instruction. When you get home, it's difficult unless you're really very dedicated into your practice. I find that with all of the teaching that I do, and right now it's 2 evenings for the adult ed, and then occasional days to work with Sasha at her studio with other students. Then I go out into my own little room, my own little studio, and I usually work on a class schedule so that I know what I'm doing ahead of time. So I do a lot of yoga during the week. It's not something that I say every day at 8 o'clock in the morning I'm going to do it. All of a sudden, if I have a few minutes, I'll go out and do it. I'll practice my yoga. It's nice to hear what Karen is saying, because I don't always get feedback from my students. And it makes me smile inside to hear that, because that's exactly what yoga does for you. It's not just for the physical aspect, but it's also for the mental and spiritual aspect. And I don't mean spiritual like in a religion. I mean in the way you're feeling. I think yoga is very good at helping people to reduce stress, and this stress comes in everyday life. So the practice of hatha yoga, the practice of the yoga asanas, using the asana to help inside the body, also works with your brain as well, to help you to ease into meditation. I try to do a little bit of meditation at the end of the class. The full class starts off with 45 minutes.
How about a typical class?
Oh, yes. You know, most people will say to me, a 2-hour class?
2 hours?
Wait a minute.
Time.
Oh, no, I'm not going to do a 2-hour class. And I do know that a lot of the other classes I teach for other people, it's only an hour and a half. But you need that extra time, because we go into Shavasana. Shavasana is quiet relaxation at the beginning of class. You need to do that because most people are running in from a very busy world, a busy time, busy work, busy homes. You lie on the floor, you listen to the instructor's voice, you relax, you go into your breathing. Usually in a hatha yoga class, breathing is taught because it's a very important part of the class. We do what is called pranayama, and in the breathing we learn to release into the asana. And
which is?
Asana is a posture.
Okay.
So when you're in hatha yoga, you're doing the breathing, the postures, the asana, and then the relaxation and meditation. So you really need the time. In a 2-hour class, I do a lot of talking, I do a lot of instructing. We don't just come in and I say to you, now we're going to do downward dog, now we're going to do upward dog, now we're going to do bridge, now we're going to relax. Generally, I will tell you what you're doing, why you're doing it, and how to do it. Because most people are confused and they like that. I also remind you so many times to breathe. My people go home and say, I hear you saying breathe at night in my sleep. But the breathing is very important. So you learn the asana, you learn to release with the breath, and then you learn to meditate and relax with it.
So it opens with relaxation and ends with relaxation.
Yes, it does.
So how does one, and maybe this is the breathing, so I could answer my own question, but how does one not go grocery shopping in your head during those times when it's because of that busy world that people come from?
This is one of the things that I brought out to my class when I say to them, what are you thinking about when you're in class? What should you be thinking about? The thing is, you think about your breathing. You totally focus on the asana. The asanas can range from very intricate stretching postures to very quiet stretching postures. What you're thinking about, Jeanne, you're thinking about yourself. You're thinking about the quiet you feel. You're thinking about the way you're holding the asana and the way you're releasing in your breath.
So physically, talk a little bit about, so what does it do for the physical body?
For the physical body. When you're in an asana, you're in a yoga posture, you're in a yoga stretch. And what you're doing here is you're holding it. It's quiet on the outside, and on the inside, with the breath, it's the action of the muscles inside the body, improving circulation, helping you to relax. It's also strengthening. It's strengthening the bones. It's working on the ligaments and the tendons that attach the muscles to the bones. You're also helping the circulation to areas that you might find restrictive at certain times. We all walk around upright. When we go into a yoga asana on the floor, we bring our legs up to relax, to improve circulation to the feet and to the legs, to stimulate the lower body as well. It might all seem a little confusing, but when you're in a class and the instructor is giving you the direction, you just flow along very smoothly.
So if viewers were curious or even shy about taking a yoga class, your reassuring message would be?
My reassuring message would be, do not be afraid. But you need to find the right teacher.
You do.
I'm not saying, please understand, I'm not saying I'm the right teacher. There are wonderful teachers on the Cape, and there are so many yoga classes now. They're popping up all over the place. But what you need as a beginning student is someone that's going to explain what you're doing and why you're doing it. Also, it's the restorative classes and the adaptive yoga postures in the classes. And this is what I really push as well.
So what do you, when you say adaptive?
Adaptive is if you have a student in your class and they've had surgery, such as neck surgery, maybe rotator cuff surgery, maybe a hip replacement, knee replacement, surgery, a baby, spinal problems, things wrong with your spinal cord, you come to class with the doctor's clearance. And once this is done, you can speak to the instructor. So the adaptive would be adapting the yoga asana for your special needs.
So when you teach the class,
yes,
that's something that you do out loud with people? If
yes, I do.
So
yes,
this is the maneuver, but if you've had this or this or this,
yes,
this is how you can make the adjustment.
Absolutely. I don't know if
Karen, I know you had mentioned.
I've had hip surgery. And it didn't go so right to begin with. I've actually had 3 on the same. And there are certain poses I can't get into. I can't sit with my legs crossed because of my hip. But she teaches you, or the way around it, and you learn eventually what your body will do and what it won't do. And there's always a way to get into the pose that's easier for you, instead of, you know, the exact, you know, diagrammed pose. Okay, well, if you can't lift your legs up over your head to do a half shoulder stand, do it on the wall. And it's much easier. And so you adapt your body to the asana as you go along. And you actually get to a point where you get so much flexibility that you end up being able to do a lot
Getting
more.
to that point,
Yeah.
anyway. Yeah.
Right.
And the breathing,
Yes.
that's one thing I do carry with yoga with me all the time. I use the breathing to de-stress, even if I'm at work. And that's a real benefit.
Yeah.
Most of us don't breathe correctly anyway. We don't get enough air in our lungs, and it really makes a difference.
It does.
So the stress relief, learning how to breathe properly,
Flexibility.
Yes.
another one of the benefits. So, and I think many viewers have probably heard this from either their physicians or physical therapy, if they've ever had that, the importance of stretching. So yoga
Yep.
is all about that.
Yes.
Amazing.
And then there are some that say, that's not enough of a workout for me. You know, well, how do you respond to that? Because
Well, you know, I think just listening to Karen, everyone responds differently to the yoga asana. Yes, there are some practitioners who are much younger who would like a more stimulating class, a more hot type of yoga. Yoga was basically meant to be quiet. It was meant for the quiet stretching and the quiet breathing. We do have some asanas, such as the salute to the sun, and of course some of the other asanas that we hold that work more with the core of the body, that bring a lot of heat and energy, and you really do feel like you've had a workout.
Yes.
It's not all
Definitely.
quiet.
Definitely.
It's not all quiet.
so participants can put whatever they want
As much
into
into it.
Yes.
Yes, as much into it. And you know, Jeanne, I start my classes usually by saying, if there's anything that you want to discuss, call me at home. If there are any problems you've had, if you've had any recent surgeries, talk to me so that I can help you adapt into the class. Now, as far as a restorative, that helps you to restore the body to better health. And again, it works with the breathing, it works with lung function, which I go way back. I had lung reduction about 18 years ago. It was because the right middle lobe of my lung collapsed due to pneumonias. I never thought I would get back into my yoga. It was 2 months later I was teaching classes. And I think just doing the breathing, doing the stretching, and listening to my own body, it seemed to help a great deal. To me, yoga is something you keep with you for the rest of your life. I started very young, and I think I'll be doing it for quite a while. And I'm hoping that Karen does the same,
Yeah.
and my other students as
Yes.
well.
We have a lot of students who I think will.
Yeah. It's
Once
good.
people get hooked on it,
Yes.
it's hard to give it up because
Yes.
they feel the difference.
Yes.
And when you can't do it, you miss it.
Yes,
Yeah.
you do. Your body almost screams for it.
Yep.
I did 3 classes on the beach this summer, and that was wonderful. But then when you're off a month or 2, and you're only practicing a little bit on your own, or maybe you're not practicing, your life gets busy like everyone else's, and you don't live in an ashram, which is a place of yoga study.
Yep.
You know, your body starts screaming and saying, I've got to get back into it. You know the difference right away.
Yeah.
Makes a big difference.
Yeah. That's good. That's good. So, what about the medical community and how they feel about? Is it something that people that are attending the class, if they have any compromises, should check with their physician? And
Most
what kind
definitely.
of response do they get?
Most definitely. This is what I say also, never go beyond what your body will allow. If it hurts, you don't do it. I don't believe in no gain, no pain, or no pain, no gain.
Right.
I believe that if your body is in pain, it's telling you to stop what you're doing. As far as the medical community, I think it's wonderful because I think now they're coming around. Every time you put on the television, every time you open a book, there's something new on yoga. I'm very fortunate to have a physician myself, my own doctor. When I tell him what I'm doing, he's amazed and he listens. and he also encourages. And I think that if more doctors encourage their patients to go to not only physical therapy, but to go to a yoga class with the right yoga teacher, it would help their own health care.
Is physical therapy part of the discussion with the physician, or do you find somebody like a physical therapist maybe embraces yoga more than some of the traditional?
Yeah, I think most definitely.
Yeah.
Because
they're into the body mechanics.
Yeah, I've
and
had
understand
physical
it.
therapists in my class who have come
okay.
to me afterwards and said, you know, we do that. We do that.
Yeah.
That's exactly what we do. And if I happen to be reading or studying and I notice that a lot of what we're doing is the same thing that the physical therapist is doing, so I don't know who's copying who.
There's a lot of crossover there.
Yeah, crossover.
That's a great thing.
Yeah, it is.
Why do you think that is, that within the last few years, because I've noticed it as well, that there just seems to be more in the general information out there that promotes yoga or embraces it, or because people have had such good results, or it's just?
Well, myself, I feel that it's out in the media more.
Yeah.
And I think people have had wonderful results. I also think they want to get away from taking medications, taking painkillers, taking certain mind-altering drugs that will, you know, take away from their own health. So I think that that's what it is. And even someone like Karen, after her surgery, coming to class. I have other patients who have had knee reconstruction, knee replacement, who have come to class, and if they're not able to do something, I tell them not to do it. And why do they come to class? Because they enjoy the quiet, gentle stretching and breathing.
Yeah.
I actually had an experience at Mass General when I had some heart surgery, where they were teaching yoga. Several nurses had gotten together, and they were teaching yoga for relaxation in order to help the patients to be less stressed about the situation they were in.
That's true.
I was amazed.
Yeah. Do you love those
Yeah,
stories?
I loved it.
Yeah.
Absolutely.
Because it's not a competitive activity.
No, it's not.
At all.
No, absolutely. And I tell my people when they come in, this is not competitive. Don't look at me, don't look at your neighbor and say, if you can do it, I can do
Right.
it. Listen to your own body.
Yeah.
And only go as far as your own body will allow.
Yeah. I think that's a great reminder for
Right.
people, because
Yes.
there's so much of that other out there.
Competitiveness.
Yes.
In any type of athletic.
Yeah, just in day to day.
Yes,
Yeah.
yes.
Yeah, so that's
It's
great.
it's not for just hard bodies.
No,
That's it.
no,
It's
and
for
it's
everybody.
not for young people,
Yeah.
it's for the
for
seniors,
everybody.
and it's for the older people as well, and I really like to push that.
All inclusive.
That all
Yeah,
inclusive.
men and
it
women.
really is,
Yep.
yes.
And equipment, you don't need.
No. You need
What do you
maybe
need?
a mat on the floor, and if I tell them to bring a tie or a strap, they can bring in their old necktie from their husbands or family. You really don't need any equipment. You only need your own body. And it's the weight of your own body that works on the inside as well.
So you talk about massaging all the inner organs.
Yes,
So that's
definitely.
part of the whole circulatory.
Massaging it, and with the circulatory system working and gently massaging into all of the muscles, the organs, and the tissues. This is what the health aspect is.
Nice. So we only have a few minutes left, so I wonder what would be some of your parting thoughts to any viewers that are on the fence, or, oh, I used to do it, I haven't done it for a long time, I probably can't do it anymore, or why should I, or what's a...
Well, I think I can just say yoga is definitely a tool for better health. That if you want something else in your life, look into a yoga class. Look into a yoga class with a very well-trained instructor. Don't do it just from a video or from a tape. Go to a class for the instruction. Speak to your own health care provider. Speak to your doctor.
Definitely. But it's for everybody. It's easy. It's not something that you have to, you know, work at every single day, but the benefits you get from it are fabulous.
Yeah, it's true.
Good message.
Yes,
Good
it is,
message,
Jeanne.
yeah. Lots of options on the Cape?
There are so many classes on the Cape. I think you just need to look into it. All you have to do is Google it. Google yoga on Cape Cod.
Okay.
Go on your computer, and it will list different places. It will list different teachers. Try a class. Any class that's worth its weight will allow you to come in and try the class without paying. And if you
Okay.
like it, then you stay.
often at senior centers or through the school systems or the independent?
Senior centers. There's a great class at the senior center here in Yarmouth. I know there's one in Dennis.
I think there's one in Barnstable as well.
In Barnstable as well. So there's yoga all over the Cape. And then, of course, the adult ed classes, which I think are wonderful because they're economically, they are very easily affordable. And as I said, even though it's a 2-hour class, you come in when you can, you leave if you have to leave early, and I think it's open to all, men, women, and children. Not so much children at night, but men and women.
Though they do have children's.
Oh, they do have children's yoga.
Yep.
Yes.
Are they offering something like that in the schools, do you know?
I don't know if it's offered definitely in school, but I do know that Sasha has a children's yoga class at Sasha's Yoga and Massage. She teaches there. And then I also know that some teachers have spoken to me about doing yoga in their own classrooms to prepare the children for tests and to help relax them.
Start them early.
Start them early. Teach them to breathe and to relax.
And they will actually be able to touch their toes.
Yes.
Well, thank you both for being here today. I appreciate
you.
your time. It's great information.
Okay, thank you.
And I'm Jeanne Sarnosky, wishing you good health and good health care. Let me just sit for a minute.